Next, ladies and gentlemen, we have the address by Dr. Asela Gunawardena, Director General of Health Services, as our guest of honor this evening. I would now like to invite Dr. Uppul Pathirana, the Joint Secretary of the College, to introduce him.
Thank you very much. So it is my pleasure to introduce our second guest of honor, Dr. Asela Gunawardena, Director General of Health Services. Dr. Asela Gunawardena, an alumnus of Badulla Uva College and Badulla Central College, excelled in both academics and sports, including hockey and cricket. He entered the University of Peradeniya in 1984. Completing his medical education while earning university colors throughout his undergraduate years. Dr. Gunawardena began his medical career as a district medical officer in Badalkumbura in 1994. He has held several key positions in healthcare, including medical officer of health, regional malaria officer, Regional Director of Health Services, Medical Superintendent of Base Hospital, and Directors of Teaching Hospitals. He holds a Master Degree in Medical Administration, as well as diplomas and Master Degrees in Buddhist Studies, and also Business Administration. He is currently pursuing a PhD in Buddhist Studies. Dr. Gunawardena has received both local and international training in various fields, significantly contributing to his work in developing healthcare systems and institutions. He has won numerous national and international productivity awards and is one of the most senior medical administrators in this country, with extensive experience in both preventive and curative healthcare sector. It is now my privilege to invite Dr. Gunawardena to share a few words with us. Over to you, sir.
Good evening to all of you. Today's chief guest, Dr. Anil Jasinga, Secretary to the Health Ministry and the Mass Media. And the guest of honor, Professor Anita Simmons, keynote speaker, Professor David Deming, and all the other guests from overseas, and Dr. Niranjan Dissanayake, the President of College of Pulmonologists, and the Secretary to the College, and Professor Dushantha Medagidara, the Senior Professor of Medicine, University of Wayamba, and all the other past presidents, council members, all the ministry officials, all the other professional colleges representatives, all the UN representatives, all the professors, all the consultants, medical officers, and all the media people, ladies and gentlemen. It is both an honor and a privilege to stand before you today as the guest of honor at Respire 2025. This gathering is a testament to our shared commitment to a world where every individual, regardless of their background, has the right to breathe freely and live a healthy life. The theme of this year's conference, Equality in Respiratory Health for Right to Breathe Free, resonate deeply with me. Breathing is most fundamental act of life, yet for millions around the world, it remains a daily struggle. Air pollution, occupational hazards, lack of access to healthcare, and socio-economic disparities have created a world where the simple act of breathing is not a universal right, but a privilege for some. Respiratory diseases are significant global health concern which pose a complex challenge impacting societies, healthcare, and economics of the worldwide. Conditions like chronic obstructive pulmonary disease (COPD), asthma, pneumonia, and tuberculosis contribute significantly to illnesses and healthcare costs. From 1990 to 2090, a total deaths and prevalence of chronic respiratory diseases have increased by 28% and 39% respectively. Based on the latest data available in 2019, the chronic respiratory diseases were the third leading cause of death globally, responsible for 4 million deaths and affecting nearly 500 million people. COPD and asthma are the most common among them. COPD alone account for 3.3 million deaths. It is estimated that number of COPD cases among those aged 25 years and older will increase by 23% from 2020 to 2050, approaching the figure 600 million patients with COPD by 2050. Further, the diseases of infectious nature, such as lower respiratory tract infections, COVID-19, and tuberculosis, are among top 10 leading causes of mortality in the past few years. We shouldn't forget that the infectious disease with epidemic and pandemic potential continue to be the global health challenge. In the last century, influenza originated avian, swine, severe acute respiratory syndrome, coronavirus, and the Middle East respiratory syndrome, MERS, were the most damaging respiratory infections for human beings all over the world. The global trends in infectious respiratory diseases in 2023 indicated that SARS, influenza, and respiratory syncytial virus were co-circulating widely, though it varied among different WHO regions. It is worthwhile to note in 2023, the total of 1.25 million people died from tuberculosis, while 8.2 million were newly diagnosed with the disease. TB has secured its position being the world leading cause of deaths from a single infectious agent back following 3 years, which it was replaced by coronavirus disease, that is COVID-19. Tuberculosis was also the leading killer of people with HIV and major cause of deaths related to antimicrobial resistance. Respiratory disease have a major impact on Sri Lankan health system. Together, chronic respiratory diseases, pneumonia, caused the highest number of hospital deaths in 2017. The burden of lung diseases, the BOLD survey revealed an overall prevalence of chronic obstructive pulmonary, that is COPD, was 10.5% among Sri Lankan adults age over 40 years. Around 17,000 men who are reported to have cancers annually, 10% are having lung cancers. Further, despite commendable progress in our healthcare, tuberculosis remains a significant public health challenge with an estimated incidence rate of 63 per 100,000 population. That means 14,000 cases per year. The case notification rate has been stagnated over the years between 8,500 to 9,500, indicating around 5,000 undetected cases over total estimated TB cases. The rising problem of poor air quality is claimed to be responsible for the rise of respiratory disease, namely obstructive lung diseases, bronchial asthma, interstitial pneumonitis, and lung cancers. We all have witnessed the past few weeks when the smoke entered our airspace, making the air quality not conducive for general population. Even today, the index is 153. This has increased the hospital admissions significantly, causing an additional threat to already stretched health system. Indoor air pollution emerges as a threat in rural communities where firewood is used for cooking in poor ventilated kitchens, leading to late onset wheezing among non-smoking women from rural communities. We understand that the prevention and control of respiratory diseases needs a multi-pronged approach. Government commitment, increased domestic funding, and workforce strengthening of primary health care are mandatory components that should be focused. Preventive, curative, rehabilitative, and palliative care should be streamlined and make accessible and acceptable to people, ensuring universal health coverage as depicted by this year's theme, equity in respiratory health for the right to breathe free. With primary and secondary healthcare strengthening projects, we will continue to address these important aspects. We witnessed a revolution in the practice of respiratory medicine in Sri Lanka. It is happy to see specialists in respiratory medicine could be able to provide their expert knowledge and services throughout the country. I would like to emphasize that tuberculosis is one of the diseases which sets target under the SDG goal in 2030 and NTB in 2035. It is also an important indicator that measures UHC, that is universal health coverage. I make this opportunity to request the respiratory consultant and all the respiratory community to provide their support in TB case finding and to improve treatment outcomes, which are most important at this juncture. Nothing could be achieved without stakeholder collaboration. I believe that prevention and control of respiratory diseases could only be achieved through the whole of society, whole of government approach. Health alone cannot make any significant change. We should collaborate and coordinate with animal health and environmental sectors while networking with all other relevant sectors. Most importantly, generating public awareness and empowering the public to look after their own health. The health of the community to which they belong is paramount important to reducing the disease burden of respiratory origin. Finally, let's be vigilant. Strengthening our environmental monitoring, including air quality, is crucial as the impact of climate change could be deadly in future. Investment in continuous surveillance on pandemic diseases, both in human and animal health sector and at the point of entry, is mandatory to generate early alert for pandemic prevention, whereas preparedness should be the high on the list to avoid the history to be repeated. The government has taken many steps, including securing funds to improve surveillance, preparedness, and response. I trust the College of Pulmonologists and the membership will extend your support to the momentum to prevent, control, and eliminate respiratory diseases with different potential. Thank you for your dedication, your passion, and your unwavering commitment to this cause. Let us leave here today inspired to take action, to breathe life into our shared vision, and to ensure that the right to breathe free become a reality for all. Thank you.
Thank you, sir, for your valuable thoughts and for gracing this occasion tonight. Please accept this token of appreciation by the college as a mark of our appreciation and acknowledgement.